indeed, there's still a lot remain to be done for improving the care for epilepsy patients, but a lot really is happening. So in the upcoming symposium within the American Epilepsy Society annual meeting, I'll be talking about some what are the strategies, particularly around drug management, that we can implement to help patients achieve seizure freedom. Yeah, it's really important because that's what patients tell us. And there's been lots of studies, showing that only seizure freedom can consistently improve the patient's quality of life, reduce their comorbidities or even mortality. There's a lot of work done in this area, but more recently, we have actually interviewed patients directly and to hear the patients' their own voice. And they told us that even for someone who's recently diagnosed or newly diagnosed, the uncertainty is really of whether they can achieve seizure freedom is creating a sense of vulnerability, and they feel that their life is on hold. And this effect kind of filters out to all the family as well, the workspace, as you say, there's stigma around it as well. And so it's to the patients, it's really important to be able to have some certainty that the treatment they're receiving is going to be effective and that they can achieve seizure freedom. So the other side of the coin, of course, is side effects. And a lot of medications we have still have a lot of side effects, which can be like allergic reaction to more dose-related, usually more cognitive kind of side effects. And for women of childbearing potential, there's an added problem of teratogenicity for some anti-seizure medications. And for a lot of the new medications, we still have very little information. So that's a major issue when managing women with the childbearing potential. Other side effects that really can affect how we manage patients will be around mental health side effects, and that's kind of compounding the mental health issues that patients already experience. So we desperately need medications that are more tolerable, that have fewer side effects for patients. I think there's a lot happening in terms of personalizing treatment. As I mentioned, the problem with being the uncertainty around response to medication, and that's because the paradigm we've been using is very much trial and error. But there's a lot now happening in terms of personalizing treatment based on individual characteristics, by use of artificial intelligence, developing models that can predict response to certain medications, or through just based on clinical information, or through looking at genomic imaging, or incorporating EEG information, which can be now collected long-term using minimally invasive devices. So with this new information, there is really a sense in the community that we can move away from a bit working in the dark to really be able to personalize or individualize treatment for the patients and give them greater certainty, and being able to allow them to select the best medications or treatment strategies, which can be non-drug treatments, for the individual patients. Another area is around using stem cells collected from patients, derived from them, and use them as a model for drug identification and screening as well. And so I think that data has kind of give us a lot of hope and promises, which will be achieved in the next few years.